I came to Cáceres, Spain to help train surgeons in a new technique, one called TAMIS, which stands for Transanal Minimally Invasive Surgery, and another one called taTME, which stands for Transanal Total Mesorectal Excision. Both of these techniques are important in the removal of tumors of the rectum. The focus of this course is to train surgeons on these techniques. So they come here and they learn how to do this so that when they go back to their respective institutions, they'll be able to do safe surgery. Great question. In this animal model, we're trying to understand and train surgeons how to go about doing the dissection, how to safely use the TAMIS and taTME techniques and platforms so that they're comfortable with the technique, so they're comfortable with the instrumentation, and then they can safely do it in a human. These facilities are outstanding. They're some of the best I've seen. I've trained surgeons all around the world in TAMIS and taTME, and this actually is on par with the best of the best. So it's a fantastic facility and a great place to train. It's been a fantastic improvement. It allows surgeons to access in ways never before imagined parts of the rectum and to access tumors that are very, very low. Ordinarily, these were so hard to access that many patients would end up with a permanent colostomy bag, but no more. We're able to access these tumors in a way that allows us to reconnect and adequately remove tumors. We think that this technique actually allows us to do a better job at removing the tumor, so the chance of cure could potentially be higher because of that. Also, the TAMIS techniques allows us to go high into the rectum and lower part of the sigmoid colon sometimes to carve out or remove a tumor transanally. This is much different than the ordinary approaches to removal of tumors of the rectum, where ordinarily you would have a big operation to go in the abdominal cavity, take out a piece of the bowel. That patient has pain, the patient has to stay in the hospital, sometimes for days and even weeks. Now we have a newer technique that allows us to go in without any incisions on the abdomen and remove the tumor transanally, and the patient can go home the next day. So it's a big improvement. Well, these sorts of things that benefit patients are the future. So TAMIS and taTME are the future. Well, practitioners, the modern surgeon needs their own classroom. Just like we were in school, we learned math and science. The surgeon needs a special, very advanced kind of classroom. And that means an advanced facility that will allow that surgeon training so that they can learn new techniques in a way that makes them comfortable and they feel confident when they go back to try these approaches in a human. And so this kind of facility here in Cáceres allows us to do just that. It allows us to train experienced surgeons in new techniques so that they can go back and do this safely and with good effect in their home institutions.